Hello, and welcome to today's Beyond the Sea webinar. My name is Ashley Cuffia, Consumer Health Coordinator for the Southeastern Atlantic Regional Medical Library. Before we begin with today's guest speaker, there are a few administrative things I'm going to run by with you. We have a couple of questions listed from the presenter on the screen. If you would like to share any activities you've done or resources you've utilized related on LGBTQ health, please feel free to share in the chat box. As you are sharing, communicating, and asking questions in the chat box, please be sure to send to all attendees so that I, our guest presenter, and your colleagues can see your questions and information shared. If you need closed captioning for today's webinar, a link has been posted in the chat box. Today, our guest speaker is Juan Carlos Vega. Juan Carlos Vega is a librarian and a public health advocate dedicated to identifying opportunities, converting them into actions, and creating change at the local level. His involvement with health promotion and health disparities began in 2001. Mr. Vega transitioned to the nonprofit world after 10 years of working for academic libraries and at the Library of Congress in Washington, D.C. His experiences in health issues include tobacco, alcohol, cancer, obesity, influenza, and health disparities. In 2010, he helped establish the Citizens Alliance pro-lesbian, gay, bisexual, transgender, transsexual, and ally health nonprofit organization to help reduce health disparities among local Latino and LGBT communities in his native Puerto Rico. Everyone, please welcome Juan Carlos.
Hello, good afternoon. Thank you, Ashley, very much. I'm really excited to be here. Happy Pride to everybody. June is usually Pride Month, but Pride events and activities are celebrated throughout the year. So first I want to truly thank you all for being here, and especially to Ashley Cuffia, the consumer health educator, who invited me to participate in the Beyond the Sea webinar series at the Southeastern Atlantic Regional Medical Library of the National Network of Libraries of Medicine. And as I mentioned, this is Pride Month, so it is even a great opportunity for you to learn about national and local health resources to guide your research support, to support your medical students coming into your library, or supporting the general academic research that takes place in the institutions where you work, and specifically on LGBTQ populations. Moving beyond the regular book and journal searches, I'm going to showcase many resources that are key to understand and help reduce LGBT health disparities. And within those health disparities, throughout the conversation, I'm going to be putting a focus on LGBTQ people of color, or POC, which includes Black or African American, Latinx, Latino, Latina, Asian American, Pacific Islander, Two-Spirit Native Americans, populations where there are many LGBTQ health disparities as a population overall, but once you go into this specific populations, LGBTQ people of color, the disparities increase even higher, and that's what the research is starting to show. So today, this is what we will be talking about. We'll learn about just general LGBT cultural competencies, like what is the acronym, about LGBTQ communities. Don't expect to come out with understanding what each of the letters of the acronyms are. There's a lot of tools out there, much better short videos to help you understand, but I'll give you an overall perspective on that. And we're going to discuss LGBT health disparities, specifically as it relates to policies and issues beyond sexual health, HIV, STDs, and we're going to identify some strategies to help support the inclusion and to engage LGBTQ communities, not just at your library, but when you're doing research. And most importantly, throughout the presentation, I will be highlighting resources that are at the national level. Many of them are government. Some of them are at the local level. They're non-traditional. Many of them are online sources. There are many are government reports that are not even published for the library to have unless you keep a repository of online government resources. And we'll also look at what others are doing. So I will be making mention of many of these organizations that are national groups that easy Google searches will help you identify the content. So we're going to be talking a little bit about, sexual orientation and gender identity, and that's what LGBTQ is. It's the communities and how data is collected and how, the community is referred to us. But that is just one of many layers and identities that each one of us have as individuals. So as a gay man, I'm Latino, so that you know then my sexual orientation and you know my ethnic background. But then how, that's just two out of what is my education, what is my age, what is my Spanish is my first language. So how do we look at all those identities to make sure that we are providing proper health care or making sure that the research is culturally competent. So I just would like everybody to take 1 minute to just pick one of your identities. So you can go through each of those identities: ability, age, gender, religion, what is your ethnicity, your culture, your language, your race, education. So just pick one. And I'm just going to give 30 seconds for everybody to just pick one identity. And if you can type it on the chat box for everybody to see, let's see what happens. So as you can see, interesting. So people are choosing gender, sexual orientation, ethnicity, age, education, religion. And right there, on just, about 10 that has been answered, you see a huge difference on how each one of us define ourselves. So it's really interesting for us to always keep in mind that there are layers of identities of each one of us, and we need to look at each of those identities before we can provide the proper care. So questions to you overall, which we don't need to answer, but for you to think about is, could you pick one identity right away? Was it easy? Was it hard? Were there two that you couldn't decide from? So those kinds of questions make you think about how much you actually know about your own identity, right? And as I mentioned, sexual orientation and gender identity are just two of those layers of identities that LGBTQ communities have. But somehow, when you do journal searches or, in most of the work that is happening and research is on HIV, STDs, HPV, some now, which is all related to our sexual health. And that, again, that is just one of the layers that we have in our complete wellness and health care. We do have diabetes, we have cancers, and is the research, are the medical healthcare providers and facilities providing this support, right? So these are the things that we need to look at. So quickly, just to talk about LGBTQ plus communities, and I added specifically plus just on this slide, it divides on sexual orientation and gender identity. So the sexual orientation refers to lesbian, gay, and bisexual. So lesbian is a woman that is attracted to another woman physically and emotionally, and gay refers to most of the time to men that are attracted to other men. Bisexual is an individual that is attracted to both sexes, right? And when we come to gender identity, which is then the P and the Q, right? We're talking about two different issues. So gender identity, which we'll go a little bit into it in the next slide, it goes for the transgender, which is the T, or the queer for Q or questioning, right? And I put self-identification, and I always like for the individuals to have an option to self-identify beyond the boxes that we may provide them. So here you can see a little bit further in 4 layers, right? Sex, gender identity, sexual orientation, and gender or gender role, right? And within each one of those categories, there are descriptors, right, that talk about what is your gender identity. What is your preferred gender role? Are you more male or female, disregarding if you were born man or a woman? So what is your sexual orientation? Are you queer, and what does that mean? That means that you probably don't fit in any of the above categories: lesbian, gay, bisexual, and heterosexual. And is this a different term that in the past it's being used negatively, but the community, especially youth, and to a degree research is as well, is being inclusive of acknowledging that queer and gender non-conforming and those individuals that do not fit within a binary of male and female are being considered, because each one of those are different definitions when you're doing a level of data collection or research, right? So important to think not just of data collection, but of the types of users that you are going to be receiving in your library. This is an example, and what we may expect of what a male student should look like, and maybe it's okay to have a gender role more feminine, right? And be okay with us behind the desk, right? And the last thing I want to mention about this slide is that this is, in general, each community locally self-identifies differently. So, for example, in Puerto Rico, they like to use double T's to separate transgender from transsexual. In other states, they prefer to use the Q or the I for intersex. So there's many other categories, and this is just to give, and descriptors, and this is just to give you a sense of how diverse we are. Therefore, that's how our research needs to show the actual health disparities. So when we're talking about gender identity, and this image is from the Trans Student Educational Resources, a nonprofit organization led by youth that are doing great work on gender education. So when it comes to gender identity, we all have a gender identity, and it's that internal sense of being a man or a woman or none, because you don't fit on that binary, or actually a combination of both. And for many of us, that matches the sex that we were assigned at birth. But for transgender people and queer individuals, it doesn't, because the birth certificate may say that you were born male, but in reality, you have lived the life of a woman your whole life, disregarding the sexual organ that you may have. It's how that sense of how you feel, or who you see in the mirror when you look at yourself. So our gender identity may or may not match our appearance or bodies, or our own perceptions of us and those of others, or even society expectations. So this is a hard conversation to have, just like in the past. We used to smoke in planes and offices, and now don't you dare, because the policies are protecting us, right? So at one point, our society will probably re-evolve into having more than just two genders, because when we look in the past in Native American populations and indigenous communities, there are more than just male and female genders. So this is a great example that I like to use about identities and pronouns. So this photo is the sons of Mrs. Mira, and the artist is Hector Silva. This photo appeared in a magazine called Gay, Latino, and Macho in 2014. The title is The Struggle to be Queer and Out in a Machismo Culture. Through this art, the author, Hector Silva, brings to life the subculture of gay Latino men in ways that nightclubs cannot, and offers an inside look to what happens in the community. He depicts the traditional masculine homeboy or ranchero on their laps in homoerotic poses and acts, and has been heralded by many as shining a light in the gay Latino community. Silva explained the meaning behind his art, and he just wants to show the different sides of machismo in a very soft light. If you look at it, this is the same individual having three different identities, and who knows it, different pronouns as well, right? So the one on the right is more mainstream. The one in the middle is more feminine, and as I mentioned, the one, the homeboy ranchero look on the left, are completely three different identities. So when we're thinking about identities and pronouns, it is okay to ask, and that's what you should do. What is your pronoun, or what is your preferred pronoun? But this is not a preference of a pronoun. This is my pronoun. So how do we ask sometimes about the pronoun? People can get uncomfortable because it's not a question that we're used to all the time. But sometimes just let's move away from pronouns and just call individuals by their name, Juan Carlos, right? And refer to them as individuals and people versus trying, eliminating those pronouns. That keeps us in that binary. So LGBTQ communities, when we think about LGBTQ communities, we think about LGBT Pride Month, right? The flag, and we're here. But I'm going to talk a little bit about LGBT communities from the perspective of these two women, Sylvia Rivera on the left and Marsha P. Johnson on the right, and Sylvia Rivera on the left. So Ms. Johnson was an African-American transgender woman and LGBT rights advocate who was an outspoken for trans people of color, and she was one of the who spearheaded the Stonewall Uprising in 1969, along with Sylvia Rivera on the left and other transgender individuals of color. Hollywood and many other stories do not even showcase these two women on what happened that day in 1969. But these women were not just there, they were present leaders in the community. Sylvia Rivera was a transgender activist and self-identified drag queen. Along with Marsha P. Johnson, she was the co-founder of the Street Transvestite Action Revolutionaries, who was dedicated to help homeless youth, drag queens, and trans women of color. She was born and raised and lived most of her life in or near New York City, and she was Puerto Rican and Venezuelan descent. So these two women are examples of what the communities have looked like forever, even if mainstream LGBTQ communities look differently, right? But the history of the communities tells us that they're all structured and they're not homogeneous. They're not only white only. The majority of the health disparities are usually in LGBTQ communities of color. So as I mentioned, I usually use community because LGBTQ are communities, not just one single community. And for what we hear in the media, the national issues include marriage equality, bathroom policy, sex and gender education. For Latinx, African American, Two-Spirit, and Asian American Pacific Islander LGBTQ communities, the issues expand to immigration and deportation issues, machismo, spirituality, language, and acculturation issues, leading countries of origins to come to the U.S. to then continue to be being discriminated against, even within the same LGBTQ communities. The LGBTQ communities have borne a heavy burden, specifically transgender individuals, that are killed monthly, if not weekly, in this country, and internationally even more. So there is a lack of sense of trust of LGBTQ communities in general, but specifically with institutions and governments that have historically discriminated against. So, but again, I want to mention, and we're going to go through some of this, the strong LGBT community structures that offer social support, health services, legal assistance, and provide a platform for where people advocate. And it is really an untapped resource. Here are examples of just LGBTQ people of color events and perspectives that are happening nowadays along with these regular pride events, right? And these are women that are trans, they're leaders, they're community facilitators, they're homeless shelters, they run homeless shelters, they're patient navigators, they're mothers to those that reject those where they come from, right? And to the left, Lorena Borjas out of New York City, Bambi Salcedo out of California, Andrea Molina out of Texas, and Ruby Corrado out of Washington, D.C. on the right. They all are researchers, directors of nonprofits, employ LGBTQ people, and understand the needs of brown and black LGBTQ folks so that they are included in the research that is happening. Overall, we know youth face significant challenges, but when we talk about LGBTQ youth, they continue to be bullied and harassed, shamed, and subjected to violence and abuse, coming out younger than ever, so there's more stress for them, and a greater risk of substance abuse, addiction, and risky sexual behavior. And the research that's out there is showing that. For LGBTQ older adults are different, many similar issues, but very different ones as well, including isolation, retirement. Many don't have children, and for sure, lack of competent services. This map shows state non-discrimination laws in the U.S. The ones in purple show states banning discrimination based on sexual orientation and gender identity, so it covers LGBTQ. The ones in pink are banning discrimination only based on sexual orientation, so transgender individuals are not included. And these maps, this is from National Gay and Lesbian Task Force, and the Movement Advancement Project have similar maps that specifically talk about policies affecting by state, employment, housing, credit, and all that stuff. All of these are factors that affect the health of LGBTQ communities. So when we talk about LGBT health disparities, research of the Institute of Medicine has clearly stated that lesbian, gay, bisexual, and transgender individuals face barriers to health care that affect their overall well-being. We smoke and drink more, higher risk of depression, and less frequent cancer screenings. And again, this is in general this is not detailed enough to know that layer of ethnicity and race. How are the rates of tobacco use and depression and anxiety among gay African American men versus white gay men? So those kinds of comparisons are essential to understand LGBT disparities. So these are some of the disparities which I just want to quickly mention, right? Tobacco, alcohol, and drug use, and research, including the American Cancer Society, states that, smoking results in significant health disparities and kills 30,000 plus LGBT people per year. Youth face elevated rates of suicide and frequently face bullying, sexual abuse, right? And the mainly lesbian women have higher risk for breast cancer, because never having given birth, alcohol and tobacco use and obesity are issues that are part of the communities, and the statistics, the research that is there is showing this. And goes again beyond HIV and STDs, which are still higher rates in comparison to the general population. And among the most important health disparities are the lack of insurance, those policies that we just looked in the map, and the actually receiving culturally competent health care. And this is an image created by LGBT Health Program of Centerlink, which shows at the top, right in 1964, when the first Surgeon General report about smoking and health came out and said that smoking kills. But it wasn't until 2014, 32 Surgeon General reports later, that LGBT are clearly delineated as a population experiencing tobacco disparities. So that lack of understanding within the government as well, which pushes the research at universities and libraries, affects, health disparities. We're happy that it is included, but the loss has been incredible. This image can be downloaded if you join the membership for LGBT Health and many other resources. So when we're talking about LGBT people of color health disparities, as I've been mentioning, there are studies that are coming out, but again, there's a lack of data. So Lambda Legal and Nonprofit organization did a healthcare fairness survey, which states that overall shows disturbing numbers of LGBT respondents, as well as those living with HIV, have experienced significant healthcare discrimination. But the most important part is that most notable in every category of discrimination covered in this survey, people of color respondents were more likely than their white counterparts to experience discrimination than substandard of care. This is disturbing because this is where the real disparities are, but you probably won't find this report in your journal search, right? So targeted marketing, right? This looks great. All of these rainbow colors are really good, right? And Human Rights Campaign, which are one of the leading organizations, they include Coca-Cola and Pepsi Plus. Perfect scores when it comes to rating workplaces for LGBTQ equality, right? So that's great. And then Burger King sells us a proud Whopper in San Francisco, California, Pride. And Doritos launches Time Rainbow chips in support of the LGBTQ community. And all of these organizations, since funding, some of the money goes to proceeds go to community-based organizations that are engaging LGBTQ communities. And this is great, right? The alcohol industry, if you go to any LGBTQ bar in the country, you will find one of these Absolute Vodka bottles, right? Which was released originally for Pride Month. And the problem is that, these are great because they show inclusivity. I mean, that Coca-Cola ad is beautiful, the Doritos one, but while they're good for inclusion, are they good for our health is the question. And as we learn from the tobacco industry advertisements, right, they insert themselves in the promo, like here on the left, American Spirit. They have inserted themselves at the top. This is recently, in the last 2 years, but they've been doing this with Project Scum since the early 1990s, where subculture urban marketing focusing the gay community in the Castro to ask new consumers to sell them cigarettes. And these have been happening for decades, just not in the traditional way. And now we see vapor electronic cigarettes being one of the main sponsors for the Miami Beach Gay Pride. This is in 2015, but they did it in 2016 as well as 2017. I just checked 2018. They're not a sponsor. Maybe the logo is not there. Vapor shops are also sponsors of many Pride events. So what can you do to support LGBTQ inclusion in your programs and services at your library, AHEC, or research center, knowing these health disparities and the intersectionality? So you always want to think of language, right? In terms of using partner versus wife and husband. Do you move away from the male and female binary and always provide, neutral options, right? If your physical setting includes a rainbow flag, gender neutral bathrooms, if the signage shows a gay couple, right? Are your events and programs celebrating Pride Month or Latinx Pride events? Are you inclusive in social media? Is your staff diverse? Are LGBTQ staff hired, mentored, and moved into leadership? Are your policies non-discrimination, inclusive of non-discrimination for sexual and gender minorities? Can people really come out easily at your place of work or your research project, right? If the administration includes forms and self-ID options, is the leadership out or has families or leadership that has LGBTQ families? And your collections, do you have LGBT sources? And how can this be improved, right? So when you're thinking about where are LGBTQ communities, there are many places where you can reach out and you can tell your researchers where they can go and find the individuals so that they can have a good sample, right? Or where you can reach out when you have events or you need support or you need a research partner. So LGBTQ communities disregarding of your physical location has a presence, even if you don't know about it. So in print media and online sources, so many communities, depending on where you live, LGBTQ restaurants and bars may have a magazine or newspaper that is free and it's local, weekly or monthly. Sometimes they're printed business directories, but online you find LGBTQ chambers of commerce, healthcare provider directories for culturally competent providers by state. Not all states, right? These are individually moved events and programs that don't necessarily have a lot of funding, but at least it's a place, right, where we can reach out. And then online Facebook groups, there's so many, Twitter, Instagram, and there's online LGBTQ specific social and mobile platforms like Curse and Scruff where you can reach out. This is right beyond the usual in-person of bars and clubs and restaurants, pride events, any social support organization. There's also churches, open door churches, university programs and resource centers, health programs, and of course the leadership and local activists. Again, where can you find them? Centerlink, the community of LGBT centers, which helps to develop strong LGBT centers and help create healthy communities, have a directory of about 200 LGBT community centers in the U.S. and across the country. LGBTcenters.org, just go, find the one in your state and see what they have, what they're doing, and how you can partner with them to support in what research is happening, or expand even your collections, because there is a lot of content on this LGBTQ community centers that we have no clue about it because it's not published in a journal. They present on the research, they present on the work that they're doing to reduce health disparities, but it doesn't necessarily get to the library. So the library kind of needs to get out and get to them by calling or emailing, and they're partnering with departments of health, they're partnering with academic institutions to, one-on-one partners in which they are relied upon in order to expand the research and data collection and inclusion of LGBTQ health individuals. So this is an example of what other organizations are doing, right? So let's focus in the 4 logos in the middle, right? So many public libraries are including the rainbow flag in their logos to celebrate Pride, and this alone means inclusion in many ways for LGBTQ individuals, especially if it comes from a Department of Health, like the New Mexico Department of Health, right? So when you have Department of Health creating rainbow logos for Pride, it means inclusion. And it doesn't mean that everything's perfect in the Department of Health. It means that they're working in cultural competency to tend to the population, that they're probably doing a level of data collection, partnership, and engaging leadership. So the same thing happens. There's LGBTQ book clubs, many across the country. This transgender resource collection, again, I don't know if your library has a specific LGBTQ health section or collection, right? But each library has different resources that are being inclusive of LGBTQ communities. And of course, the National Library of Medicine has this type of webinars as part of LGBT Pride Month, just like the American Library Association has LGBT Book Month and the top list of LGBTQ books. So are you able and implementing some of these ideas in your library? So also beyond the library, so when we're talking about specific health issues, these are examples of what tobacco control and prevention is doing to engage LGBTQ communities and decrease health disparities. So if we start from the left, si fumas se te apaga is key to the erection dysfunction because of smoking, right? And this is inside when you open it, it had a condom. And this is from the Puerto Rico Department of Health. On the other side, it said 1-800-QUIT NOW. I don't think they did it specifically to target the population, but it was for the general population, but it definitely was a hit among gay and bisexual men in the island. So smart thinking, reaching LGBT smokers on their smartphones, this was a project of the North Carolina Department of Health, in which they were reaching out to LGBT smokers through their smartphones. They have a history of going to pride events to distribute cessation material and support. They're called the Quit Line Ladies every time the Department of Health shows up at the pride events in Raleigh and Durham. The last drag is a specific cessation program for LGBTQ communities. It came out of San Francisco. There's some evaluation, scientific journals that have evaluated the program, but there are other evaluations that have been done that are probably not published. Then if we go to the bottom left, break the cycle and celebrate Pride Month smoke-free. This is what the CDC posted a few years back in their Facebook page to celebrate Pride Month. So if the CDC is doing it, everybody else can. And this is Idaho on the right, integrating LGBTQ community members into their campaigns was a success. So beyond journals and books, right, what other resources are there? So these are all government resources guiding LGBT health research and training. And the most important one is the Healthy People 2020, which has, right in the middle, it has an LGBT component. And this is what many departments of health and research and work is, this is what they're doing to guide the work, right? So the thing is, it's just some guidelines. It has research behind it, but this is where most of the research needs to be focused on. And then how does the government support it? For example, the CDC, there's different surveillance systems, the BRFSS or the YRDS, right? So every state may gather, every state is different. Some may gather sexual orientation, some may gather gender identity, some may gather both, some may gather none. So there's no national data. There may be some state data, and that is just starting to come out. And kind of same with YRDS. But the data may not be published, but you can refer your researchers to find out if the Department of Health collects, because they can give you access to that data, right? So there are, agencies like SAMHSA, right, that provides, training for substance abuse treatment for LGBT individuals, and documentation on Affordable Care Act enrollment for LGBTQ communities. And there's the LGBTQ communities, we are well represented within librarians and information specialists, so we're making sure that our stories are being collected. So right there on the left, on the top, we are here, we are clear, and we are in the public record. Federal government documents on the LGBT movement is this Friday. And I'm sure that has health-related content, but it's really interesting how we're moving forward in the collection of documentation. So again, beyond the journals and books, these are organizations that you want to contact because they are key when it comes to LGBTQ health and research. Many of them are doing research, different types of research, right? But they are leading the way in the nation in terms of how LGBTQ health disparities are managed. So on the top left is the Center for Excellence for Transgender Health out of the University of California in San Francisco, and they're increasing access to comprehensive, effective, and appealing health care for transgender individuals. The Trans Student Educational Resource, TSER, which had one of the other images as I mentioned, is led by transgender youth, and they publish and supply trans educational resources, help create transgender policies. So they are a group to reach out to if you're working with LGBT and with transgender youth, right? On the right, on the top, LGBT best and promising practices throughout the cancer continuum. This is one of two LGBT promising practices that LGBT Health Link, a program of Centerlink, have created to engage LGBTQ communities and help reduce the health disparities. While these best and promising practices have not been fully evaluated, they are based out of the work of researchers. And that's why they are best and promising practices, because they haven't been fully evaluated. They are key to engaging groups at the local level. And even though this is specific on cancer, they have another one on tobacco, they can be applied to any other chronic disease or health issue or concern. The American Psychological Association has best practices for mental health facilities working with LGBT clients. The American Medical Association has information in creating an LGBT-friendly practice, including sample intake forms, policies, and has an advisory committee on LGBTQ issues for AMA to address LGBT needs of physicians, LGBTQ physicians, medical students, and patients. So if you're doing research, this is definitely a group that you want to reach out to, but you may not have a specific, journal entry in your database. Amnesty International, of course, they have a gender, sexuality, and identity project. And then at the bottom, the National LGBT Cancer Network provides support online groups for cancer survivors, has a directory of cancer treatment facilities across the country properly serving LGBTQ communities, where they usually even have a personal contact who will guide LGBT folks in setting up appointments and assure their comfort and safety when they arrive. They're out of New York City, but they work nationally. Bottom in the middle, the National LGBT Health Education Center, a program of the Fenway Institute. They're leading the way in research, training, and health policy when it comes to LGBT health. And of course, the Gay Lesbian Medical Association, which has a directory of providers on their website. And I want to mention LGBTQ Scholars of Color Network is a Facebook group, which is also doing great work. So finally, your local resources, right? And if we go to the left, we have on the top Orlando Black Pride, and in the middle, the annual DC Latinx Pride. Usually in every state and city, there are Black Pride events occurring. There are Latinx Pride events happening. Reach out to those communities. Refer your researchers to those events so that they go and reach out into where the health disparities are truly happening, right? So at the bottom on the left, there's usually an Office of LGBT Affairs in every state. Sometimes it's the Office of Civil Rights or Department of Civil Rights. Though that example is specifically for Philadelphia on the left, and to its right is the Michigan Department of Civil Rights. But they do a level of work at the state level. I wouldn't say they're research institutions, but as government entities, they do have reports and content that they may have been developing on LGBTQ related issues and health, environmental risk factors and such. So at the top, gay straight alliances are probably in every state, in every district. Universities and colleges usually has an LGBTQ resource center or a group that can support the work of researchers. And finally, reach out to nonprofit organizations. Just put the name of your state. This one, the example is for South Carolina, but it can be Equality Alabama, Equality Maryland, Equality Florida, Equality Mississippi, Equality Virginia. And they are local partners. They are researchers. Many of them are engaging in a level of research and partnering with universities and other institutions to move the reduction of LGBTQ health disparities into the public health. So the most important thing, which is why I put it in the middle, is to be an ally, right? In every possible way. You don't have to be a member of the LGBTQ community to be interested, of course, in working to help reduce LGBT health disparities. So with that, I want to open to some questions and discussion, clarifications. Ashley, you tell me, do we have any questions happening right now?
If anyone has any questions, please post them in the chat box, or I can try to figure out how to also unmute you if you just post in there that you have a question.
So while some of the questions, any question comes up, so I want to clarify, each state, and sometimes we think that our state is too conservative to have, LGBTQ communities, or there aren't enough LGBTQ communities in my state or jurisdiction. And in reality, there are. We just don't necessarily know of a nonprofit organization or the LGBT leader speaking on behalf. But so I hope that this, examples of resources that exist at the local level really support the work of your researchers, of your medical students, and even your own inclusion within your library. It's about, getting to know these local resources, which you can adapt from the national level, but in reality, it is best if you focus on your local communities.
Okay, we actually have a couple of questions. The first one is, do you have any recommendations for small steps individuals working within libraries can take when they don't have much overall institutional support?
Okay, so I've been doing this work for like 15 years, and somehow I feel that every time I talk and discuss either a webinar or a meeting or a network conference, like a level of coming out happens, right? So that there's a need, right? And sometimes it's LGBTQ individuals themselves that are in the forefront of moving forward for LGBTQ services and, collections or whatever. But the other part is always the ally, in which there is usually, unless there's just two of you in the staff of the library, there's usually one or two or even three or more individuals that are not just members of the LGBTQ community, but that may be allies. And of course, we don't want to, push the envelope with anybody, but you can literally identify an opportunity or an idea for an event or an activity in which you think we can talk about LGBTQ inclusion to that one or two individuals that you feel are okay and friendly to the conversation, right? So that then from there, you have 2 or 3 staff members that then it may be, easier to push into a level of institutional support, right? And the other thing I would say is look at the institutional policies. Are the policies including sexual orientation, gender identity? Do you include, if everything man and woman, wife and husband, right? So those kinds of terminologies are really an overall way of tackling, institutional support, just because it's part, of the institution per se, which trickles down into events and activities and collections. So.
Does anyone else have any questions?
So I want to mention many of these organizations provide cultural competent trainings, culturally competent materials to help institutions and organizations engage in LGBT health and help them reduce LGBT health disparities. And it's a process that may take a long time because staff changes, because priorities changes, because the government changes. But the important thing is, as each one of us individually, as librarians and information specialists or program managers at AHACs, right, and libraries of medicine, how do we identify and collect, make a list, right? And usually it happens in a website, here are the resources that are available. But not everybody necessarily will have a website. Maybe it's a blog, maybe it's a Facebook group, which you may not necessarily be able to link to. So it's about creating, not just disseminating the resources that you have at the local level to improve LGBTQ inclusion and the reduction of health disparities in the research that your institution is doing, but also to be able to maintain up-to-date information on what your community looks like and what their needs are. So I am definitely, I wanted to move to here. This is my contact information. I'm available to support any of you work on inclusion in your organizations, or I can also refer you to organizations that can help you establish training, cultural competencies, improve policies to protect LGBTQ individuals and continue the inclusion of LGBTQ in research studies.
Okay, if there is no more questions, I just have a little bit more housekeeping for you. I want to thank you all for attending today's presentation. As a reminder, today's presentation was recorded and will be posted on the NNLM YouTube page as soon as possible. I encourage you to subscribe to the page as you will be notified as new recordings are made available, and I'm going to put the link for that in the chat box right now. Our next webinar at the SCA region is on Thursday, June 7th at 2 p.m. Our webinar is titled Gauging the Quality of Open Access Reference in PubMed, the Medline, PubMed Central, and PubMed Connection, presented by Anna Krampel and Carolyn Lee Curry. Details on registering for this webinar will be available soon on the nnlm.gov website. I will be sending out an email to all who have attended today to evaluate today's webinar and receive your MLACE credit. After you've completed the evaluation, you will receive instructions on how to claim MLACE credit through the MedLib Ed website. I want to thank you again for attending today's webinar, and thank you very much, Juan Carlos, for your time to present today's webinar. And everyone, have a great afternoon.
Thank you.